People often ask me, what are the scenarios in which I should stop taking Mounjaro or Wegovy? I'm Professor Joseph, founder of Dr. Frank's Weight Loss Clinic. So there are really 4 scenarios that I can think of where I would definitely be having this discussion. Scenario 1, if you're having side effects, no matter what dose of Wegovy or Mounjaro you're on, that's reason to stop taking the medication. The journey towards getting healthier must not be one where you have to suffer side effects. Obviously, you got to make an effort to reduce the dose if that's important. Also, there may be ways in which your clinician will guide you to do what we call microdosing, a newer concept that a lot of people are adopting. And we find that that works sometimes to avoid like a single large dose causing a peak of the medication causing you side effects. So talk to one of our nurses and we'll be able to support you with that sort of thing as well. Scenario 2. If you're planning on starting a family, have got to stop taking these medications at least 4 weeks before you start trying to conceive. The other thing I will say about starting families is that we do get rarely cases of women who think that there's no chance that they're going to get pregnant, but often get caught out. One of the things that we've got to be aware of is that when you're overweight, your fertility can be affected. Whilst you may think that you're not going to get pregnant, because a lot of women who come to our service and I look after have problems with fertility. But what happens is that when they lose weight, their fertility levels go up. So you've got to make sure you're using appropriate contraceptive protection when you're on these treatments. And if you do get caught out and you end up becoming pregnant, please make sure that you stop the medication straight away. The third scenario, if you're planning surgeries, for example, if you've got a big operation coming up, we do tell people if you're on it for weight loss, you must stop taking it a week before your general anesthetic, where you're going to be put to sleep for the surgery. That's because there is a risk that's been found because of the slowing of the stomach, emptying out, you can get what's called aspiration, where food can regurgitate up from your gullet and then go down the wrong way into your lungs. What we like to do is if you plan surgery, stop it a week beforehand, and then you could usually start it the day after that. The other common scenario where people ask me if they can stop their Wegovy and Mounjaro is when they achieve their target weight. Now that's debatable, and I'm not going to answer that on this video because there's a lot to say about that. Watch my other video, which talks about how to manage stopping, if that's what you're going to do, to achieve your target weight.